Elsewhere, let's turn our attention now to the outbreak of the Human Metapneumovirus in China. The development there has now caused the Nigeria Center for Disease Control and Prevention to allay fears following the outbreak of the virus in China and other regions. The G of the NCDC, Jide Idris, says Nigeria is at moderate risk for the virus. He also mentioned that the agency is taking proactive measures to ensure the public is informed and really prepared for any potential impact. Although no case of HMPV has been reported in Nigeria, the NCDC mentioned that it has ramped up surveillance efforts nationwide. Mr. Idris also says as of Monday, Nigeria's national influenza sentinel surveillance system hasn't reported any unusual increase in respiratory infections, including those caused by HMPV. The World Health Organization has clarified that there's been no emergency declaration amid growing attention to the rise in circulation of respiratory viruses, particularly human metapneumovirus in China. For more on the outbreak of the human metapneumovirus in China, I'm joined by Vice President Medical Initiative for Africa, Dr. Agbo Ebuta. Dr. Ebuta, thank you for joining us on the news this hour. Footages of hospitals in China overrun with masked people have made their rounds on social media. And of course, people are worried, especially about the fear of another pandemic. Beijing is attributing these new cases, especially amongst children, to what it calls a seasonal spike. Should Nigerians be worried? And is this anything like COVID-19?
Thank you for having me. To answer your question very directly, Nigerians should not be worried. And then number two, because of the information we have presently, we cannot predict clearly whether it would behave like COVID-19 virus for two reasons. The situation is evolving. We've had repeated spikes of HMPV virus in the past, infections in the past, and they were easy to contain, basically. In addition to that, given that we are just emerging recently from a COVID-19 pandemic, we generally have a robust experience in managing viral epidemic or pandemic outbreaks. So I would say that Nigerians can be reassured that, especially based on the information we have, we should have little to fear. Apart from that, we do know that, as usual, as respiratory viruses typically will affect people at extreme ages, below 5, above 65, and people with adjusted immunity, people with cancers, people with poorly controlled diabetes, people with HIV that is not properly treated, and all of that. So our intervention is probably going to mitigate whatever challenges we would have. Epidemiologically, the pattern of the disease in China has suggested that it is not more than what is typically expected. So we do not have a lot to fear. Most of our populations will be able to mitigate this impact.
So NCDC is saying Nigeria is at moderate risk. What really does that mean?
Well, that means that, number one, the risk of widespread of this infection is not as much as compared to when we feel that up to more than 80–70% of the population will be affected. Number two is that the severity, the expected severity of this infection is not going to be as expected. Number three is that the number of patients to be affected that we project will be affected by this infection will not be as maybe in COVID pandemic, where we had a whole situation to deal with and we had to set up tents, mobilize team, increase training for staffs and all of that, and even work on a vaccination.
What do you consider the standard response to a flu-like outbreak in a place like China, considering what transpired in 2020?
Okay, there are indeed some concerns on how effectively China is communicating what's really happening on ground there. To a large extent, people feel that China has not been very, very transparent with the information about the current outbreak of HMPV infection. But we do know, for example, that in the northern part of China, every year during the winter period, especially, we have a cocktail of viruses that would break out. Things like influenza virus, respiratory syncytial virus, and HMPV virus. In fact, HMPV virus, in the current spike of viral infections in China, does not account for the predominant. It's not responsible for a major. In fact, respiratory syncytial virus and other viruses are more prominent, playing a more prominent role. It's just that we have seen more cases, but this is the winter period, and we typically will expect that. In any case, when the populations are affected, most people would have no symptom at all. About 40% of the population would not have any symptom. The remaining people who would develop symptoms, up to 80% of them will just have mild symptoms, and in 7 days, most of their symptoms will resolve. But 5% of the population may have serious illness. Now, these are the people we are going to focus on. And in diagnosis and treatment, we have the capacity, we have the training in Nigeria to deliver results. It will just mean that we should identify these patients early and give them the needed treatment. There is no particular antiviral treatment for viruses. There is for this particular virus. So what we do is supportive care. Oxygen supply when they have pneumonia and they have problems with breathing, and the correct use of immune manipulating medications like steroids, which would alter the progress of the severity of the disease. But so I'm very confident that with the knowledge we have, we acquired during the COVID pandemic, with the NCDC being led by Jide Idris, who is quite an established public health expert in Nigeria, we think we have the knowledge, the historical capacity, and the political will and the support to deliver the kind of results. So Nigeria should be rest assured, but they should take preventive measures. They should do those things we told them about COVID. When you are coughing, make sure you do cough etiquettes. Use your elbow. If you don't have a tissue paper, use the tissue paper and dispose. Wash your hand very carefully when you do that. Avoid gatherings if you don't have to go. And if you have a respiratory infection, use a mask so that you don't transmit to other people. Apart from that, children under 5 should be closely watched. People above 65 should be closely watched. If they have a respiratory infection and it seems to be getting worse, they're having problem with breathing, they should present early, because early presentation is critical. This is important because we don't have a vaccine. Candidate vaccines like the RSV vaccine, respiratory syncytial virus vaccine, which appears to be like the HMPV virus, may be used, but that is being explored. But presently, we do not have any vaccine, and any treatment for viral infection by HMPV would be supportive. And in Nigeria, we have the knowledge, the experience, and the capacity to deliver.
We're really going to be counting on that, and all of the, quite encouraging comments coming from the NCDC and what you called preparation and capacity on the part of government. Dr. Agbo Ebuta, thank you so much for talking to us.